SelfShield App was developed during the COVID-19 pandemic as a response to managing people who are locked down. Basically, it allows people to keep track of their health status themselves and take action in a timely manner. The SelfShield app has multiple features, and these include self-health checking, breathing performance assessment, progress monitoring with fever charts, breathing performance chart and health risk chart, reporting of exposure to COVID-19 and reporting of test status, receiving health education from recognized sources, and receiving psychosocial support advice.
COVID-19 is transmitted via respiratory droplets, and hence the respiratory system is affected at the onset. The SelfShield focuses on detecting the changes to your body due to the novel coronavirus. It has also adapted some of the tests that your doctor would do in order to assess the function of your respiratory system. It also measures your respiratory reserve while you are healthy so that it can determine the onset of an illness early. SelfShield helps in detecting exacerbations of other pre-existing chronic respiratory diseases, which permits early interventions.
The SelfShield captures sound during two stages. First, during the stage where it asks the user to breathe to the phone. Secondly, at counting. The captured sound files then will be sent to the web server where it gets analyzed by the AI. The AI algorithm is developed in Sri Lanka by a group of health informaticians and software engineers. The uniqueness of this algorithm is its capability of analyzing sound files captured through mobile phones. As far as we are aware, this is the first time this kind of technology is used in real-life situations, which is COVID-19. Because the sound is captured without any enhancements, this technology can be used in low-resource settings. Because we have developed the algorithm to be robust, in the future it may be used to detect other respiratory disorders.
The breakthrough algorithm is capable of separating frequency, time and amplitude domains. After a very complex procedure, the AI is capable of giving us very unique respiratory parameters which will be very useful in the diagnosis of respiratory diseases. These respiratory parameters can be combined with symptoms to give an accurate results to healthcare providers. The unique dashboard we use shows aggregate and individual results, including respiratory and symptom trends. If and when necessary, we can use the dashboard to zero in on any suspicious cases with respect to the time and the geography. When the SelfShield is in place, the medical teams in respective organizations can follow up with their employees who have already given the consent to be in the SelfShield application.
SelfShield leverages the latest technology to bring our users and organizations a highly scalable cloud-based solution. Our platform is built to serve a large number of concurrent users while ensuring high and continuous availability. We use two methods to ensure our users' privacy and security. One is encryption during data transfer and storage while protecting our infrastructure against outside interference. For governments and other organizations who prefer to have a self-hosted solution, our platform can be easily deployed to their existing cloud infrastructure with minimum effort. Moreover, we have taken into consideration GDPR and HIPAA laws in our implementation, make it an ideal digital health solution.
SelfShield was an innovation that was developed to respond to the current COVID pandemic. So today we see its multiple users and people adopting it for various types of users. We've seen it being introduced in quarantine centers, Sri Lanka, and then being downloaded from around the world and used by individuals to monitor their own health, and over 2,500 users have quickly adopted the tool over the past few weeks. Then in addition to that, the corporate sector is also looking at the COVID Shield as a tool that would help them manage their own employees, both helping individuals to look after their own health, as well as when lockdowns are open up, to determine who should be coming to work and so on. So with that interest coming forward, we've now seen SelfShield being deployed out of the country. For example, in Maldives, it's been adopted by the corporate sector. In Sri Lanka too, the corporate sector is coming on board. And then we've got interest from around the world, especially with the innovation being taken globally by the Commonwealth Center for Digital Health. We've found now potential interest coming in from across the world, and we hope that as we go along in the future, SelfShield will become a truly global product.